Hello everyone. This talk is a piece of market COVID-19 research initiative that promoted on August 4th a virtual event named COVID-19 Pandemic Related Lighting Talks. Here I'm sharing with you my research on COVID-19 and ethical issues. If you are interested in all lighting talks, see the information below. Thanks and enjoy the talk.
Our speaker is Alex Martins from Theology and the College of Nursing, and he will be talking about COVID-19 and bioethical questions. Thanks, Alex.
Thank you, Dr. Hunter, for the opportunity for put that meeting together. Thanks also all for your attending. My conversation will be a little different than we had been presented until now because you show some bioethical questions that has been raised because the COVID-19 outbreak and also the way we have responded the pandemic, the epidemic here in the United States. Can you change the slide, please? So it's confronting bioethics issues that has been raised by COVID-19 and the way the pandemic has been addressed. There are basically two big areas of ethical dilemmas and questions that people have been raised and problems that have happened that in clinical praxis in terms of especially between health professionals and patients and families relationship in terms of decision making, triage protocol, moral stress, and also the other problems. You probably have heard a lot of issues connected all the lack of ventilators and have high demand of patients who get the ventilator, how you make that decision. And the second set of problems is in terms of public health strategies, those big strategies or measures that we take that impact populations, such as quarantine, lockdown, epidemiological control, and others. So all just two sets of decisions that we need to take and those who has been taken is that it happened in a context of urgency. We have to do that quickly, a lot of tension, many times scarcity. We have a lot of lack of proper information, and also in a specific healthcare context system. So that also determine some kind of decisions. And just ethical issues and the decision that has been made, of course, they have all the most important is the values and principles that justify those decisions and those public health strategies. So one example of principles or values should be those that is connected to the local population or our principles here in the United States. Like, for example, principle of human dignity, a very basic principle. If those decisions are respect the value of life and value of human dignity, regardless who they are and from where they come from. So the goal, we mapping all those problems, all those issues, is what I'm doing right now. And then move to a second step is trying to talk to people and hear their experience, trying to answer the question, how have patients or people who has been patients and their family have been impactful to ethical dilemmas and decision how they experience them, and then compare and confront what we have studied, the problems, the protocol that some hospitals has created. I am here in our area in the ethics committee of the Ascension healthcare system. So we create some protocols, some measures to help the providers to make decisions, and then compare those kind of things in a qualitative research. And then with this, our final goal is to provide some guidelines and resources to support decision-making process for health systems and providers that address the bioethics dilemmas and healthcare ethics dilemma in the context of pandemic. So in order to provide a better care and avoid those conflicts. So the takeaway of this is, in the end of the day, we have something very specific and practical that people in healthcare systems and the praxis they can use to help them to make decisions. The goal is not to provide those decisions, but provide frameworks and processes that help them to make decisions that is aligned with principles and values that respect the human dignity, and also that provide a better promotion and healthcare assistance for those in need in a context of pandemic. That is a context of tension and a lot of scarcity. So thank you.
Thanks so much, Alex. What important research, decision making, the final outcome of healthcare. That's great. Thank you so much.